Hi, and welcome to the video lecture for our Pet Immunity Test 4. So this video lecture is going to be all about infectious disease prevention and isolation protocols. So the first thing to review is zoonotic illness. So zoonotic diseases are infectious diseases that are transmitted between animals and people, so typically from animals to people. With zoonotic illnesses, the young, which means under 5 years old, the old, which means over 65 years old, and the immune compromised, including pregnant people, are most at risk and suffer the most severe and serious effects of zoonotic illnesses. So the young, the old, the immunocompromised, those are the people that are more likely to get sick and are more likely to have severe illness if they do get sick. Vet professionals also have increased risk as well, mostly due to the fact that we just see animals more often than your average person. So if those animals are carrying a zoonotic illness, we are more likely to encounter it just because of the sheer numbers of animals that we see. So there is, in your textbook, your Elsevier textbook, pages 194 to 195, there's table 7-3, and that is a list of zoonotic diseases. I encourage you to have a look at that because knowledge is power. While your veterinarians and your techs should be reminding you if something comes in and is zoonotic, they might assume you know, and if you don't know, you could be putting yourself at risk. So we should be careful with that. So moving on here, let's talk about infectious disease prevention. So it is absolutely essential to prevent the spread of infectious illness in the vet clinic to patients, clinic, staff, and other pets. If you recall back to our office procedures class, an animal getting sick within the clinic is malpractice. Obviously, we don't want to get sick. We want to protect ourselves. And if clients are getting sick from a zoonotic illness that we failed to mention, that is considered malpractice as well. And if you recall, part of our code of ethics is that we protect public health and we protect human health. And that is all involved with these zoonotic illnesses. So there are some routine practices critical to infectious disease prevention. This is just like the highlights, and then I'm going to get into these in more detail right after. So in terms of hand hygiene, hand washing is absolutely essential, and it should be done after every single patient. It's to the point, it's so ingrained in my head now. I pet my own cat, I get up and I wash my hands. So hand hygiene is really important after you've been handling any animals. We don't want to handle one animal and then handle the next animal and be spreading things back and forth between. Hand sanitizers are okay if soap and water is not available. Washing your hands with soap and water is the best method to remove infectious agents. Hand sanitizers are fine, but they're not ideal. So we don't want to use those in place of hand washing if hand washing is available. Hand sanitizers are like a backup plan. You're on a farm or something and you don't have access to running water. Hand sanitizers are your friends. You're in the vet clinic in the city of Winnipeg and there's a sink right beside you. Elect to wash your hands at the sink. And then the use of PPE as well. So wearing gloves if you're working with really yucky things. Second routine practice is cleaning and disinfection. If you're not one for cleaning, you might not like this job. Cleaning is super duper important. We need to have hospital cleaning protocols where we're cleaning all the items and all the areas in the hospital every single day. There's laundry management, and trust me, there's a ton of laundry in the vet clinic. And just as a side note on that, if you don't know how to do laundry, before going out for your practicum, maybe just get someone you know to give you a quick crash course on that. It's really surprising to me how many people come in to like volunteer or do practicums that have never done laundry before. So if you don't know how, learn how to use a washing machine. That being said, we don't sort our colors usually in the vet clinic. I don't really care if that white towel gets dyed pink. We just toss all our laundry in together, but like know how to do some laundry. And then waste management as well, which we'll get into a little bit further down. We also want to perform risk assessments of pets and staff. We want to be, and clients as well. We want to assess the animal's ability to transmit disease. So if they have an illness that is infectious, we need to identify that. And we also need to identify other pets or staff that are susceptible to the disease, and keep those people or animals away from the pet that is infectious. And then, I've said it before, I'll say it again, knowledge is power. We want to make sure that all involved people are educated. So the staff needs to be educated on disease prevention and what illnesses are contagious. Pet owners need to be educated, especially because of that malpractice issue. And then the public needs to be educated as well. Public is usually educated through like public health services, the MVMA. They really try to do a lot of outreach and education of the public. So let's scroll down here and we'll talk about hand washing. Hand washing is the number one way to prevent spread of disease. So wash your darn hands, people. It's super topical right now, right? With all this COVID stuff, you should be washing your hands really regularly. Before and after eating. Honestly, in the vet clinic, I wash my hands before and after going to the bathroom. Just who knows what's on your hands. I don't really want to be using toilet paper in my sensitive areas and, have whatever on my hands. So I wash my hands before and after. You should wash your hands after handling any lab samples. So be that blood, urine, feces, anything like that. You should wash your hands after handling any animal. I wash my hands after doing any cleaning. I just don't like the feeling of like cleaners on your hands. And plus you were just cleaning. So, get that any remaining debris off your hands. So washing with soap. So we want to use liquid soap, not bar soap. Bar soap is 100% not acceptable in the vet clinic. Bar soap is a great way to deposit germs and leave them there to pick them up the next time you wash your hands. So please use a liquid soap in the vet clinic. We want to use soap and running water. That is preferred over alcohol-based hand sanitizer. Hand sanitizers are good in situations where you don't have access to water, but as long as you have running water and soap, go ahead and use that. So your technique, remove all hand and arm jewelry. Honestly, I leave mine on because my hand and arm jewelry was contaminated as well, right? Or better yet, don't have hand and arm jewelry. I wear a watch. I will leave my watch on and I will wash my watch. I have a waterproof watch. I'll wash it with water while I'm doing my cleaning, and I tend to leave my rings and stuff at home. You want to wet your hands with warm water. Hot water is not ideal because it's really hard on your skin. It's going to dry it out. And dry skin is skin that's prone to damage. Damaged skin is prone to more infections. So remember, our skin is our protective covering. And anytime that gets damaged, we have the potential to let in infectious illness. We want to apply liquid or foam soap and then vigorously lather all surfaces of the hands for a minimum of 15 seconds. You should be singing like Happy Birthday or like Twinkle Twinkle or something like that, the ABCs. You want to make sure you're paying particular attention to the fingertips, between the fingers, backs of hands, and bases of thumbs. Lots of people wash their hands like little children. I'm just gonna try to get my hands in here, where they just go back and forth, back and forth. We want to get in between, backs of hands, focus on those thumbs, okay? I say to my kids, I have a little rhyme for them, and I say, fronts and backs and in-betweens, that's how we get our hands all clean. So that's what I tell them, to wash their hands properly, because kids are gross and they just don't know how. So we practice that all the time, and they're learning and getting better. So we want to make sure we're getting all those areas. We're not just doing a really quick back and forth motion. And then you want to rub your hands, continue doing those same motions while you're rinsing the soap from your hands under warm running water. If we leave any soap, if there's any soap remaining, that can lead to dryness and cracking of the skin too. Who knew, right? Hand washing seems like such a simple thing, but there are ways to do it correctly and incorrectly where you could be causing damage, honestly. And then lastly, we want to dry our hands thoroughly by blotting hands gently with a paper towel. Rubbing vigorously with paper towels can damage the skin. Oh, sorry, actually I have one more thing too. It's on the next page. And that's turn off the taps with paper towel to avoid recontamination of your hands. Or better yet, have a automatic tap, or some hospitals have one that's like foot operated. So when you're scrubbing in for surgery, you like step on the tap with your foot and you don't have to touch the hand taps at all, which is great. So PPE, personal protective equipment that we can be using to protect ourselves in the vet clinic. Number one is lab coats. Lab coats prevent contamination of your clothing underneath. They go over your clothes. They can be taken off and thrown into the wash, leaving your clothing underneath, in theory, not contaminated. Lab coats are not waterproof though. If you are splashed with like urine or blood, it could very well soak right through and contaminate your clothing underneath. Scrubs. So you guys will be getting some scrubs from Robertson College. So you will have your own set. And then you'll also probably want to invest in some more when you have a job. Typically clinics will offer a uniform allowance, FYI. Anyway, scrubs should be worn in the clinic only, and they should be washed on site to avoid bringing contaminants outside of the clinic. So that is the ideal. I'll be honest, I think a good majority of the places that I've worked at, we all wore our scrubs to work and then wore our scrubs home from work. And sometimes stopped at the grocery store or something on the way home and then went home and changed. So really that's not ideal. It's honestly pretty gross. If you had a really gross day, like you're gonna bring anything home that's on your clothing, right? It's potential to transmit stuff via fomite, right? We talked about those fomites being inanimate objects that can carry illness. So the best case scenario is to come to work in your street clothes, put on your scrubs, do your job, take your street clothes off anytime you're leaving the clinic. Take your scrubs off and put back on your street clothes anytime you're leaving in the clinic. So if you're leaving for a lunch break or something, and then leave your scrubs there for washing at the end of the day. Non-sterile gowns can prevent contamination of clothing as well. You'll see in the isolation protocols videos some examples of non-sterile gowns that they wear over their clothes. Gloves. Gloves protect hands from disease transmission, but they are not a substitute for hand washing. Anytime you've worn gloves, when you take those gloves off, you have to go wash your hands. So we aren't wearing gloves to avoid having to wash our hands as much. We're just protecting them. We're giving our hands that extra layer of protection against whatever gross thing we're doing, and then we're removing that disgusting layer of protection and throwing it out, and then we're gonna wash our hands. And there is a special way to remove gloves. You'll see it in the isolation protocols videos, but we want to remove our gloves in such a way that we don't contaminate like the inside of the gloves. So the first glove we remove, we're going to be removing with a gloved hand, right? So we're going to take it off touching just the outside of the glove, and we're going to turn that glove inside out. Then we can gather that glove into our hand and then remove the other glove. Now we have an ungloved hand. We're going to remove that glove by touching just the inside. So going to the inside of the cuff and pulling it off and turning it inside out. You'll be able to see that in that isolation video. So make sure you watch that so you can see what I'm talking about to do it properly. Face shields. Face shields prevent exposure to the mucous membranes of the eyes, the nose, and the mouth. You've probably been seeing face shields out and about in your daily activities now if you're going shopping. I've seen lots of people wearing face shields now if they are uncomfortable wearing masks. And then there's respiratory protection in the form of masks. Those protect the respiratory tract from airborne viruses. You need a minimum of an N95 mask to actually protect your respiratory tract. Surgical masks don't do a ton in terms of protecting you from incoming things. Surgical masks serve to protect the outside from you. So it basically just catches your coughs, your sneezes, your respiratory droplets, but it isn't protecting you from exposure from the other people or, animals around you. So just being aware of that. Surgical masks aren't protection for you, they're protection for others. There's tons of discussion about masks in the news and stuff lately because of COVID. So you might already have some exposure and knowledge of this stuff. And then footwear, closed-toed, non-slip shoes that are comfortable, you can wear all day long, are essential in a clinic. If we're in the isolation ward, we may or may not be using boot covers to protect our shoes from contamination as well. You need closed-toed shoes. You need shoes that are okay to get bleach on, because you'll see when we talk about the isolation ward, when you step out, you're typically stepping into some kind of bleach bath. So you need closed-toed shoes, otherwise your sandals or your people love wearing Crocs for some reason. Those are not great choices for hospitals, Crocs, because they tend to be like open, right? So that's not considered safe. So that's our footwear. So that's the PPE that we have for in the vet hospital. Now, and like face shield, sometimes you might not have a face shield, but you would wear goggles, let's say, to cover your eyes. That's another example. Okay, so cleaning, sanitation, disinfection, sterilization. That's our next topic. So all those 4 terms people like to use interchangeably. They are not interchangeable terms. They have different meanings, and the meanings are this. So cleaning is strictly removing organic material. Organic material are things like dirt, urine, feces, blood, and hair. So when you're cleaning, you're just making it look nice, but you're not really doing much in terms of microorganisms. And microorganisms are the things that are going to make you sick. Sanitation is reducing microorganisms to a safe level. So you'll hear about like sanitizing, like let's say hair combs or something like that at like a barbershop. So that's just reducing microorganisms to a safe level. Often cleaning and sanitation are kind of hand in hand, because sometimes just doing a little clean is going to be sanitation enough. So disinfection, this is the level that we would like to clean at in the vet hospital. Especially if we have had infectious patients in. So disinfection is the killing or preventing the growth of microorganisms on inanimate objects. We'd like disinfect the toilets or the tables, okay? And then sterilization, that's the complete killing of microorganisms on inanimate objects. So sometimes people will talk about like I sterilized that room or something like that. That's an incorrect usage, because sterilizing means that there are no microorganisms. And you're not going to be able to achieve that with just like a cleaning protocol. So some things that we should know about cleaning and disinfection is that the presence of organic material is going to prevent sanitation and disinfection. So there are 2 reasons. Number 1, organic material neutralizes most disinfectants. So if you have a bucket of bleach water and there's dirt in it, that bleach very well might not be doing anything at all at that point, because it neutralizes it. Also, having organic material remaining behind provides a hiding place for microorganisms. So you leave a smear of poop in the kennel, there's going to be microorganisms in there. So we want to make sure we get rid of all the organic material first before sanitizing or disinfecting. So we need to perform 2 separate tasks anytime we talk about cleaning a kennel, cleaning a table, cleaning an exam room. Our first step is to clean. So we're going to remove that organic material. Usually that involves wiping the surface with a cloth and some type of cleaner. Then we're going to either sanitize or disinfect. Sanitizer, disinfectant, those are often they're going to be the same product, but they're 2 different contact times. So, for example, if you use accelerated peroxide in your vet hospital, to sanitize the table needs to remain wet with the sanitizer for 30 seconds. That will reduce microorganisms to a safe level. If we want to disinfect, we want to actively kill and prevent growth of microorganisms, we need to have a contact time of like usually 5 to 10 minutes, depending on your product. So disinfection takes longer than sanitizing. So we're going to clean first, remove all that organic material, then we're going to sanitize. So make it wet with your cleaner for 30 seconds, or we're going to disinfect. So we make it wet with the cleaner and leave it for 5 to 10 minutes. So how do we choose when to sanitize and when to disinfect? You can sanitize exam rooms and instruments between non-infectious patients. Animals in for a wellness check that don't have anything wrong with them, we can just sanitize in between because they don't have any microorganisms that are going to be really nasty to the next animal. However, anything that an infectious patient has come into contact with needs to be disinfected. Usually in class at this point, I will play a fun game with you called Spot the Fomite. And I show you a bunch of pictures of exam rooms and kennels that don't have animals in them anymore. And your job is to identify what things need to be disinfected if we assume that it was an infectious patient. So fomites are things like, in the exam room, things like the pen that the doctor was using. The doctor's hands need to be washed and cleaned. Probably their lab coat needs to be changed with an infectious animal. The table, perhaps the walls and doors or tables or chairs, anything that the dog might or cat might have come into contact with. Or if it's a respiratory illness, I would just disinfect the entire room, walls, doors, everything, because of those airborne, like if they're coughing, they're gonna be spraying stuff across the room. So I would disinfect all that stuff. In the kennel, things like the bedding is a fomite, that needs to be washed. Litter boxes, food dishes, any toys, IV pumps need to be disinfected, IV poles. I'm just trying to think of other things. The scale, if you weighed the animal, the scale, and then any instruments. So the otoscope, the ophthalmoscope, the stethoscope, any of those things need to be disinfected as well. So basically anything the patient has come into contact with. It's better to be overly, like some people will kind of, I don't think it's good to like make light of people that actually have OCD, but like it's okay to be OCD about cleaning and disinfecting in the animal hospital because we want to make sure that we are not risking contaminating any other patients or ourselves and getting anyone sick. So how do we clean? Wear gloves. Things are gross in the vet clinic. Typically there's, poop or pee or vomit or something. So wear gloves. You're going to remove all forms of organic matter. So there's kitty litter or dried food or urine or feces or vomit. Clean all that up. I clean it up with paper towels directly into the garbage can. Then you can use a soap or a detergent to clean the surface. Good news is that a lot of our disinfectants are cleaners and disinfectants. So you can use the same product for both. Spray your disinfectant on, wipe down the surface, and then spray it again and let it sit to disinfect. We would like to avoid generating airborne dust because that can potentially contain contaminants as well. So ideally, if you can use like a squirt bottle as opposed to like a spray bottle to be spraying your cleaners. Don't really aggressive, like kind of like collective wipe, that kind of thing, as opposed to like just smearing it around. And then allow the surface to dry, remove your gloves and wash your hands. Why do we want the surface to dry in between? That is because, especially if we're using a different product for disinfection, we could be diluting the disinfectant if we leave it wet. And then the disinfectant might not be doing its job as strongly as we need it to be. I would like to make a note about cleaning that when you are wiping surfaces, you should use a leading edge with your cloth or rag, whatever you're using to wash with. And you should use a leading edge when you're mopping floors as well. I don't really get into floor cleaning in here. No, I don't really. So, well, just a little bit about floor cleaning. You can see more about this in the @dev video. But like string mops, you know those mops with like all the little, like the strings hanging down from it or whatever? Those mops are not ideal for a vet clinic. Ideally, you would like to have those types of flat mops with the removable heads, because you can have a whole bunch of clean heads in a mop bucket, remove the head, clean what you need, throw that head in the wash, grab a new one for the next place, okay? If you have like a string mop and like a gross mop bucket, I mean, that mop bucket's probably sitting there and is completely neutralized by whatever organic materials ended up in there from your mop. Also, you can't really have a good leading edge with a string mop because all you're gonna end up doing is pushing around dirt. So what am I talking about when I say a leading edge? Hold on a second, I'm just gonna grab like a cloth here to show you. So if I have a cloth like this, I'm just gonna move my computer back so you can see a little bit better. So if I have a cloth like this and I'm wiping like this, back and forth, back and forth, back and forth, do you see that this side and this side both have germs on them, right? So I'm pushing the germs this way now with this side, and now I'm pushing the germs this way with this side, but I'm also dragging the germs from this side back through the spot. So what I want to do is have a leading edge. I want to do this. I want to have only one side be dirty. So I'm leaving behind a clean trail and just bringing along the dirt with my cloth. Okay, so that's a leading edge. We can do that with a mop as well if we have those flat mop heads, because you can push around the dirt and keep it just at the, you can keep like the front end, the leading edge to collect the dirt. You can't do that with a string mop. A string mop, you're just gonna be pushing it back and forth. They're kind of like the grossest mop method and should really just not be used in vet clinics. So disinfection. Disinfection must be preceded by cleaning. It's recommended to use goggles, sometimes even masks, because a lot of the disinfectants can be really irritating to your respiratory tract. So you're going to apply the disinfectant according to the product label. You want to use the correct dilution, and I'll show you some math at the end of this on how to calculate the dilution. And you need to observe the correct contact time. It must remain wet for the full duration. If it's 10 minutes, it needs to be wet for 10 minutes. If it dries, sorry, I just realized this isn't in focus anymore. If it dries, it's not going to have properly disinfected, so you'll have to make it wet again. And then after it is that contact time, so 5-10 minutes, like set a timer, come back to it when the timer goes off, and then dry that surface after the contact time is complete. Okay, so moving on to waste management. What do we do with all our garbage in the vet clinic? So biomedical waste needs to be disposed of in a biomedical waste container. So these are things like animal tissues, so anatomic waste from surgery. So the testicles, the uterus and ovaries after a spay or neuter surgery, the growths after a lumpectomy, the entire limb after an amputation. So anatomical waste, really highly contaminated materials, so any blood-soaked gauze from surgery, and dead animals. So dead animal, or any of these biomedical wastes, typically you're gonna have a container in the freezer that's storing like your animal tissues and any materials. Dead animals usually are going to be sent for like communal cremation or private cremation depending on the owner's wishes. So those are going to be stored separately, probably in the same freezer, but they will be stored individually instead of just in this bucket. So this bucket's often referred to as the parts bucket, which is maybe kind of a gross term, but that's where you're going to put any of those like parts removed after surgery. And all those things need to be sent for incineration as well. So when that bucket is full, we just remove the bag, like it should be a bag-lined bucket. Remove the bag, tie it up, and send it for incineration the next time you have a waste pickup. Sharps containers, these are also considered biomedical waste. but we want to have, we don't want to include sharps in with our animal tissues. Those are going to be two separate types of containers. So our sharps container is going to be things like needles, scalpel blades, razors, glass slides, and cover slips. These need to be disposed in properly labeled, puncture-proof containers. You should have actual biomedical waste labeled sharps containers in your vet hospital. Things like coffee containers or peanut butter jars are not acceptable. And these also need to be sent for incineration. A couple notes about your sharps container. I think we talked about this before in our safety lecture during office procedures. But when you are handling sharps, you should not be collecting sharps in small containers and then dumping those sharps into larger containers, because there's potential for you to get poked with something or cut. Also, you every time you're pouring things from one container to another, you're introducing air, and you're possibly aerosolizing the contaminants that are on those sharps, and you might be breathing those in or exposing them into the air, etc. So you shouldn't be filling a small bucket to empty into a large bucket. You also should never be like cutting off needles or something. Sometimes doctors are cheap and they want to try to get as much into their sharps container buckets for disposal as possible. So they ask you to cut the needles off so that you don't have, like, let's say it's an insulin syringe where the needle is attached to the syringe. You don't have the whole syringe in there taking up space, but that's not safe either. Just go ahead and throw out the entire needle. You shouldn't be cutting things off of it. Any liquid wastes we're going to dispose into the toilet. So that includes chest fluid, abdominal fluid, irrigating solutions, or suctioned fluid from surgery. All those things we can dump into the toilet. And then other waste, things like office waste, like papers and, well, papers please recycle if you can. Staples, used up tape, something like that. Urine and feces are both just regular garbage. You don't need to put those into biohazard. And then disposable medical equipment. So anything that is single use that we throw out after we use it can just go into the garbage. So like bandage material, IV lines, IV fluid bags, those are all just garbage. The exception is unless they're saturated with blood. Blood is a biomedical waste, so it's going to go into the biomedical waste container or the sharps container. So you should know where these different items should be disposed. So if I ask you, where would you put a needle to dispose of it? It goes in the sharps container. Where does the uterus go after surgery? It goes in the biomedical waste container. Where would I dump out abdominal fluid? Liquid waste goes in the toilet, etc. Okay. So staff vaccination and training. All staff in the vet clinic should be vaccinated for rabies, tetanus, and influenza, which is the flu. You should be up to date on all three of those vaccines working in the vet hospital. And then all staff, and that includes volunteers, should be trained about disease and injury prevention. Safety is so important. Safety is number one in the clinic. So everyone in that clinic should be trained how to work safe. In terms of client education, all clients should be educated about the zoonotic risks of owning pets. So anyone coming in with a new puppy or kitten should, their exam should include this discussion. So we should be talking to them about what things are zoonotic. So we know a few of them now because we've learned some of the infectious illnesses in this course. In our next course in parasites, we're going to learn about some more things that are zoonotic. So we should include all those in our talks with owners about zoonosis. If we have, let me just scroll down here. If we have a patient that is diagnosed with an infectious disease, we need to talk to the owner or the client about how that disease is transmitted and for how long. So you know those things now because you've been learning them in this course, right? How is it transmitted? Aerosolized respiratory secretions, saliva to blood via a bite. And then how long are they transmitting that virus for, right? So remember we talked about parvo, that it's for like a month or a couple months after the disease is cleared up. We also want to know who is at risk of contracting the illness. Are family members at risk? Are other pets at risk? Is it the young, the old, the immunocompromised? We want to share that information with the client. We do want to talk to them about what symptoms would look like in a human and when they should seek medical attention. We want to talk about how to prevent disease transmission, so like cleaning with bleach, etc. And what public health enforcement issues are applicable. So like if they have an animal with rabies, that is a reportable illness. We do need to report it to public health. Okay, so that's kind of our prevention stuff. So we've covered that first section here. So now let's move on to our isolation protocols. So when we have a patient with an infectious illness or a zoonotic illness, we need to put them into the isolation ward. I can't stress enough that the isolation ward is not a storage room. Sometimes clinics just don't see that many isolation cases and they want to fill that isolation room with a bunch of random crap that they're never going to throw out, but they don't have anywhere to keep it. That's not what the isolation ward is for. We want to consider that isolation ward contaminated. Anything that goes into the isolation ward should not come out of the isolation ward unless it's been disinfected. So what are the rules of the isolation ward? Supplies must be gathered prior to entering the ward. There's no quick in and out of the room. Typically, clinics will have a cart that just lives in the isolation ward that's stocked for general treatment supplies and restocked as necessary. So it has things in there like catheters, bandage material, scissors, alcohol, disinfectant soap, or antiseptic soap, sorry. IV equipment, things like that. So in your actual notes, there is an extensive list of things that should be kept in the ward. So have a read through those and do know some examples in there. Any item that leaves the ward is either going into the garbage or being disposed of in the appropriate method, or it's being disinfected. Traffic in and out of the ward is restricted to as needed only. Typically what I like to do is assign one staff member that goes in and does all the treatments with that patient all day long. So I don't switch out with other staff members if possible. All procedures for the patient must be performed in the ward as possible. So if you're setting up an IV or drawing blood, all that happens in the isolation ward. You need to take an x-ray. Okay, that you're probably going to have to leave the ward for, but then we are going to disinfect like crazy the x-ray room. We need to limit personnel entering the room, assign one tech per day to handle the patients. I already kind of said that. Isolation ward patient treatments should be done last after all other patients. So if I'm the only tech today and I have 4 hospitalized patients, I'm going to start my treatments with the patients that are not in isolation, and then I'll do my isolation ward patient last. The reason for that is if I handle everyone else first and get them out of the way, and then the isolation patient, I'm not risking transmitting things from the isolation patient to my other patients. If I did isolation guy first and then went to the other patients, I could potentially be affecting them with that illness. So we want to do our isolation patients last. The patient is not allowed to leave the ward for walks or socialization or anything. They are admitted into that ward, stay there until they are sent home. Owner visitation should be discouraged. I really do not like having owners come into the isolation ward. I kind of don't like owners coming into the hospital for visits at all because it usually hypes up the animal and then they're really upset after the client leaves. So I find it doesn't necessarily do anything to help the animal. But there are the occasional people that are very adamant that they would like to visit their pet. In that case, they do have to abide by isolation ward rules. So they are going to wear the proper PPE, they are going to be accompanied by a staff member, and they need to follow all the correct directions. So to enter an isolation ward, number 1, we're going to gather all our necessary supplies. I'm going to say again, make sure you watch that isolation protocols video from @Dove because it's really great. She does an excellent job discussing what to do. So gather all the necessary supplies, make sure you have everything you need for all your treatments. Your medications are drawn up, you have all the equipment or supplies that you need before you enter the ward. You're going to, secondly, make sure a foot bath is in place. I'll talk about the foot bath and what its purpose is next. And then you're going to put on the PPE equipment in order. So gloves, I don't have on here, but shoe covers if you're going to be wearing shoe covers. A blue impervious gown or a biohazard suit, depending on if it's zoonotic or not. So a blue impervious gown is adequate for non-zoonotic illnesses. You will want a biohazard suit if you are dealing with a zoonotic illness. You need mask or goggles or face shield or hair cover, which is called a bouffant. The second pair of gloves going over the first pair to cover the wrist of the gown. So you're double gloving here. Then you can enter the ward and perform all the treatments as necessary. So let's talk about the foot bath or a foot mat. So the purpose of these is to decrease contamination of footwear, but you should know it does not eliminate the contamination of footwear, and we'll talk about why in a minute. Foot baths are shallow containers containing a disinfectant. Litter boxes are great for this. They're nice and shallow. You can step right into it. If it's kind of slippery, you might want to put a towel and soak the towel with the disinfectant. Mats are a spongy material and they're saturated with a disinfectant. I think mats are kind of gross because they're difficult to clean. And, I see my battery's about to die on my computer. I should plug it in. They're kind of gross. They're difficult to clean. And I feel like, right, you get any organic material on there, you're inactivating your disinfectant. So foot baths or foot mats are placed at the exit of the isolation ward. And that solution has to be changed daily or if there's any gross contamination. If you can see organic material in there, your disinfectant is no longer disinfecting. And the solution of choice has to be effective against the specific pathogen. That just makes sense, right? No point in having a disinfectant in there that doesn't kill parvo if the animal in your isolation ward has parvo. The solution has to be stable and it has to have a short contact time. So the reason footwear does not completely eliminate contamination is that when you step into a foot bath, most people are not standing in there for 10 minutes, right? They'll maybe splash around in there for like 10 to 15 seconds and then they're stepping out and going on their way. So I think foot baths sometimes give people a false sense of security, but you are not really disinfecting your shoes with a foot bath. So do be aware of that when you're using foot baths. So to exit the isolation ward, we have some steps here. So we have that, I put an infographic up that shows you the PPE sequence. You can have a read through of those. It's a CDC document and it shares with you ways to put on, the order to put on, and the order to remove your personal protective gear. So you are removing your stuff inside the isolation ward, okay? You're not going to take all of this contaminated stuff out of the ward with you. So you're removing your stuff in the ward. You're going to remove the PPE in this order. And while you're doing that, you need to remember that the outside of the gowns, the glasses, the gloves, the mask, the gown, they're all considered contaminated. Even if they don't look grossly contaminated, assume that they are, okay? So just pretend that there's like a thin smear of poop all over the outside of the gloves, the mask, the gown, and that'll encourage you to not touch it. So we can remove our shoe covers first, because we're wearing our gloves for that and our shoes are going to be considered, the shoe covers are going to be considered pretty dirty. We're going to take those shoe covers and put them into the garbage. Usually we have a garbage dedicated specifically to the isolation ward. You're going to remove your outer pair of gloves. Again, make sure you watch the video to see how to do that. You can touch the outside of the glove when you're removing one glove with the other glove. You touch the inside of the glove when you're removing the glove with an ungloved hand. So once those gross outer gloves are removed, you can remove your goggles or your face shield. If you have a bouffant on, you could take that off now. You have your gown next you can remove. So they show you how to remove that in that isolation procedures video. And then isolation in the ICU shows you how to remove the gown if you need to reuse the gown. So watch that video as well. Then you can remove the mask. She'll show you how to do that as well. Ideally, again, pretend that the outside of that mask is smeared with poop. Do you really want to touch that? No, not really. So you untie your mask and then don't touch like the actual part that's in front of your face. You can untie your mask and then touching just the ties at the back of your head, direct that into the garbage. And then you can remove your inner pair of gloves, again, using that technique so that you're not contaminating your actual hands. Then you're gonna step into a boot bath and remain there for the duration of necessary contact time. It's a minimum of 30 seconds to a minute. Longer is great, but I don't know anyone that's gonna stand around for 10 minutes in a boot bath. And then you need to wash your hands immediately. I honestly double wash my hands when I'm leaving isolation. I wash once, wash again. Sometimes if I'm really concerned, I'll even throw some alcohol on my hands. So that is our procedures for going in and out of the isolation ward. So I do really encourage you to watch those videos because they're great. They show you really well and explain really well and give you some tips on how to handle that isolation ward protocol. So now that the animal has left the isolation ward, they've gotten better and we're sending them home, we need to clean up that isolation ward. So how on earth are we going to do that? We need to make sure that we are cleaning everything in there. We need to disinfect everything in there because we are considering the entire room as contaminated. So our first step, we're going to clean. We're going to remove all gross contamination, all organic material, and that's going to be placed into the isolation garbage. After we've done all that gross contamination removal, we're going to clean all items using a detergent. We're going to clean the kennel, all 7 sides. 7 sides, you're asking me? Yes. So when you're looking inside the kennel, there's the floor, there's the ceiling, there's the left side, the right side, and the back side. So that's 1, 2, 3, 4, 5 so far. 6 is the inside of the kennel door. 7 is the outside of the kennel door. So all 7 sides need to be cleaned. We're going to clean dishes and litter boxes, any supplies or equipment, the walls, the counters, the floors. Floors should be done last because as you're wiping all the other things, kind of clean like top to bottom, right? As you're wiping all the other things, contamination settling onto the floors. So then you're going to allow the area to dry or remove the surface water. Then you're going to spray every surface with your disinfectant that will kill the virus or bacteria in question. And you're going to make sure it's the correct strength. And you're going to let that sit for the contact time. It has to be wet the entire time. Then you could rinse with clean water and dry or just dry, kind of. If it's like a dish, I'll rinse it, but if it's just the kennel, I'll just dry it. And then all isolation garbage is considered biohazard waste. So we're gonna place it into a biohazard bucket and that bucket goes for incineration. So we'll bring the bucket into the room, put the garbage into the bucket, seal the bucket, and then we need to disinfect the bucket before it leaves the room. Anything that goes into the isolation ward has to be disinfected before it leaves the isolation ward. And then laundry. Laundry is the last thing that you'll be doing. Laundry we want to handle separately from regular laundry because it's contaminated. So it should be collected in an isolation designated laundry basket. Or, a basket's probably better because then you can disinfect the basket when you bring it out. I was thinking if you had a bag, it might be okay, but you'd have to disinfect the bag. So a basket's better. If anything is grossly contaminated, so if any of the blankets have like poop or vomit or anything like that on it, we would like to remove as much organic material as possible. So get some paper towel to remove that organic material. That should go into the biohazard bucket too. And we're gonna pre-soak anything grossly contaminated in a bleach solution, a 1 to 9 bleach solution for 10 to 15 minutes prior to washing. Step 3, we want to take that laundry basket out of the isolation ward now. That means we need to disinfect it. Then we're going to wash the laundry twice. Both times we're washing it in hot water with bleach and laundry detergent. So the first wash with bleach and laundry detergent, it's honestly probably not doing a lot in terms of disinfection, right? Because we know that bleach is inactivated by organic material. So we wash it once. It's maybe killing some things, but it's not going to really kill everything. But that first wash is going to remove all the organic material. So our second wash with hot water and bleach, that and laundry detergent is going to remove disinfect the laundry. Then we can move that laundry into the dryer and dry everything on a high heat setting. Heat kills bacteria and viruses as well, right? So heat is our friend here. Once laundry is complete, we want to run an empty laundry tub with hot water and bleach added to it. That's going to disinfect the laundry tub before doing just regular laundry again. Okay, so that is how we do isolation laundry. So you can watch that video as well, and it talks about isolation laundry, the @Dove video. So I talked about making sure you have the correct dilutions of your disinfectants. So I have some sample math questions for you here. So we're going to describe how to mix a bleach disinfectant at a 1 to 32 solution using 500 mLs of water. So you know what I'm going to do? I'm actually going to pick up my phone here and move on to my notes because I have the math handwritten in my notes here. So sorry if it's kind of shaky. So we can set this up as a cross multiplication. The 1 to 32, we're going to move it 1 over 32. We know that we're going to have 500 mLs of water, but how much bleach do we need? So a 1 to 32 solution is saying there's 1 part bleach, 32 parts water. How many parts bleach in 500 mLs of water? So we can cross multiply. You do 500 times 1, and then it'll be 32 times x. And then we can divide the 32x equals 500 mLs, divide both sides by 32. That gives us 15.6 mLs. Ignore this part. You can just add 500 mLs of water. I was thinking of something different and I did these wrong. So we're gonna add 500 mLs of water to our bucket. We're gonna add 15.6 mLs of bleach, and then we're gonna swirl gently to mix. Water first, then disinfectant. If you do disinfectant, then water, lots of them foam up, and then you just have a whole bunch of foam. And then we swirl gently to mix because we don't wanna shake or vigorously stir because, again, bubbles. So for this one, again, just ignore this bottom part. Describe how to mix a 1 to 16 solution of peroxigard using 4 liters of water. So 4 liters of water is equivalent to 400 mLs of water. So again, we can set up our cross multiplying. 1 over 16 is equal to x over 4,000. So 1 part peroxigard and 16 parts water is how many mils of peroxigard in how many mils of water. So again, we can do the multiplying 4,000, 16x, and then 4,000 divided by 16 is, it'd be like, it's 250 mLs. This would be ml, not liter. So how are we going to do this? Sorry, ignore that. We're adding 4 liters of water. We're adding 250 mLs of peroxigard, and then we're going to swirl gently to mix. Make sure you read your bottles for disinfectant. Peroxigard is a good example. Peroxigard for disinfecting kennels and tables is a 1 to 16 solution. To disinfect floors for a mop bucket, it's a 1 to 64 solution. So make sure you pay attention to what your purpose is and what the dilution should be. So describe how to make a PeroxyGuard mop bucket with a 1 to 64 solution. So 1 part PeroxyGuard, 64 parts water. The bucket holds 20 liters of water. 20 liters is 20,000 mLs. So again, we can set up our cross multiplying. 1 over 64 is equal to x over 20,000. 20,000 times 1, 64 times x. Then to isolate x, I'm going to divide both sides by 64, and that gets 313 mLs. Again, ignore this and this. We're going to fill that mop bucket with 20 liters of water, add the 313 mLs of PeroxyGuard, and then swirl gently or mix with the mop. Lastly, describe how to prepare a boot bath using a 1 to 32 bleach solution in 1 liter of water. 1 liter is 1,000 mLs. So we can set it up here. 1 over 32 is equal to x over 1,000. Cross multiply. So 1,000 divided by 32 ends up being 31 mLs. We're going to add the water to the boot bath tray, add the 31 mLs of bleach, and then swirl or stir gently to mix. Okay? Just ignore that part. So that is how we do the math for these. I'm just trying to get the focus on these. Excellent. So if you have any questions about that, certainly do reach out. I'm happy to go over it with you again. And that's everything I have for this video lecture. So I hope this has been helpful for you. If you do have any questions, please make note of them. Ask me in the virtual chat, ask me in the chat, the daily chat, the virtual classroom, or send me an email and I'm happy to help. That's everything. So thanks for listening. Bye.